I'm Tim Campbell-Smith. I'm a colorectal general surgeon and surgical tutor at East Surrey Hospital. Surrey and Sussex NHS Trust is made up of East Surrey Hospital, Crawley Hospital and also Horsham, where we do outpatient clinics. And we have main theatres here in two areas, the main theatre complex and the Princess Alexandra Theatre. We have endoscopy at East Surrey and at Crawley, and trainees are allocated to specific training lists at either site. And the clinics happen at all three sites, and we encourage our trainees to come and join in the clinics, particularly the core trainees who come in as a supernumerary and sit in on the clinics with consultants. This is a busy general surgical department split into two main firms of upper GI surgery and colorectal, with a total of 10 consultants, 4 of whom are colorectal. We run a rota with 10 SPRs or ST trainees and 10 core trainees. We have handover every morning in the postgrad centre, except at the weekends when it's done in the surgical assessment unit itself. And the outgoing on-call team and the incoming team all meet together, and patients are discussed in detail, where we can look at the clinical picture, the imaging, and discuss each case, and then they're handed on to the appropriate team if necessary.
My name's Jason Remedios. I'm a Foundation Year 1 trainee in upper GI surgery. We'd get in early about 7:30, prepare the list for all the consultants, come down to handover, and then merge the two lists if we were on take together, go on a ward round, and then we'd complete the jobs, which consists of a lot of chasing, a lot of bloods. But then in the afternoon there's scope to do what you like really, clerking, go into theatre, and then you'd re-prepare the list for the next day.
Hello, my name is Nancy. I'm one of the core surgical trainees year 2, and I'm currently doing an upper GI job for the whole 12 months. So during our day-to-day basis, depending on whether you're on call, you'll be involved in the ward rounds with the rest of the team, which involves an F1 and a registrar, and occasionally the consultant, depending on whether they're on call or not. You'll go and review the patients in the wards and have a plan for them for the day, and then hand over to the sister on the ward. Then, depending on whether there is activity in theatre, you can get involved with elective as well as emergency theatres. The emergency theatre, we call it CPOD here, which works 24 hours a day, is the on-call theatre where you can do, you can get involved with laparotomies, you can get involved with appendicectomies and other emergency operations. In terms of elective work, there are quite a variety of operations you can get involved with as a core surgical trainee, such as laparoscopic cholecystectomies, hernia operations, as well as bigger operations such as colectomy. So,
this is Copthorne ward. This is the main general surgical ward where the majority of our patients will go, particularly electively after the operations. And it's a fantastic ward, all the staff are lovely, and you'll be spending quite a lot of time here. My name's Alison Hainsworth, and I'm at ST6, training in general surgery with an interest in colorectal surgery. Normally start off with a ward round in the morning, and then move on to various elective commitments such as clinic, endoscopy or theatres, or if you're on call then obviously start off with the post-take ward round and then go on to the CPOD theatres to work the way through the cases.
This is our theatre complex. So behind me we've got 8 different theatres spread out between different specialties, including urology, gynecology and general surgery. Normally when we do an elective list, we consent our patients down near admissions, which is on the other end of the hospital, away from where theatres is. And the patients come up here to the popper area, which is the pre-operative area, and then they're taken into theatre. There's so much operating to do, so definitely come here and plant yourselves here. And for the foundation level doctors, once you guys are done with your wards and your commitments with patients over there, you should definitely pop into theatres, and there's lots of training opportunities for you guys here as well.
My name is Trudy Charnock, but please don't call me Trudy Charnock, just call me Trudy. I work behind reception most days, and I also help with the patient pathway, the theatre scheduling. We do everything here because we're all very nice and friendly.
It's a fantastic rotation. I've just finished 6 months of upper GI and I'm doing colorectal now. And for both of them, first of all, taking the on-calls, you're really quite protected because you do another separate week where you cover the surgical admissions unit, which means that that registrar is clerking the patients. So that when you're on call, you have the opportunity to go to CPOD and operate, which is really good for the logbook. In terms of elective commitments, the elective theatres, the bosses here are fantastic trainers, so you get to do a lot of cases. And then there's good opportunity to do endoscopy as well. The commitment to doing clinics is only up to 2 a week, so it's not too heavy on that side.
So this is the surgical assessment unit. This will be where you do your on-calls and you're based whilst you're doing your on-calls. And also any patients that are coming from GPs or from the emergency department will be admitted first in the surgical assessment unit. We have 12 beds for the patients and next door is the waiting room. Inside here is the doctor's office where you can find all your drug sheets and all your clerking sheets when you're on call.
As I say, we're expected to man an on-call rota of 10 doctors or 10 surgical trainees, and in addition to that we've got elective work as well, and we cover the wards as well in addition to that. So the on-call rota is basically a 12-hour shift in the morning where we see patients from A&E, patients from their GP sent into hospital, and we also cover acute trauma as well. We do 1 day on call a week as SHOs, but our night shifts are in blocks of 4. So we do night shifts from Monday to Thursday, and then the other SHO does Friday, Saturday, Sunday, covers the weekend.
Our on-calls consist of weekends, or if we do a day on-call during the week, it'd be 8 to 8. Weekend ward cover, there'd be 2 F1s on call. One of you works from 8 to 8, the other one works from 8 to 5, and it's split between general surgery, which is upper and lower, and then urology. But now they have an extra SHO, so the SHO goes and does the urology ward round. The 2 F1s are on the take and all the inpatient. So it is quite a big list, but you can get through it quickly. It's only the new patients that really take your time. So you're done, I think you'd be done by about 1 o'clock. You can then just carry on with your jobs, and then one of you leaves at 5 and you just carry on for any of the bleeps, for any other odd jobs here and there that people forget. But we don't do nights, which is good.
Within the week also there are teaching sessions. There's an X-ray meeting which is excellent on a Tuesday lunchtime with lunch provided. The foundation trainees have their own teaching at that time, so they can't come, but for the core trainees and surgical registrars it's an excellent meeting to bring complex cases to discuss. And we have a weekly tutorial or teaching ward round for the core trainees dedicated to them focusing on the MRCS exam.
So we have our set teaching from the foundation school, which is great anyway, which is at 12 o'clock on a Tuesday. But the consultants on surgery, on our RFM and upper GI, are always teaching us. So we don't really need formal things as such. So when we've got time to go and clerk, the registrars will teach us there and the SHOs. So there's actually a lot of teaching.
We do a journal club every Friday morning, which each trainee takes in turns to present a paper that they've read, and then the consultants will ask questions as well, and that's really good practice, especially for us coming up to our exams.
There are academic opportunities, getting involved with doing audits or quality improvement projects, or getting involved with some research projects depending on the consultants where they have any research interests, and leadership roles, leading the audits and the quality improvement projects, as well as becoming a trust representative or becoming core surgical trainee. That can boost your CV in the long term if you are willing to apply for specialty training jobs in the future. As a core surgical trainee, you also have your ordinary teaching days, which they go based on specialty themes such as vascular surgery, plastic surgery, which is a whole day where you get the opportunity to get taught lecture-based, as well as doing some hands-on where you get consultants to teach you at the same time.
Be aware there's so much going on, there's so much operating to do, there's so much to see, and even if you're not operating, just watching just helps a lot. So I think just being keen, getting into theatre, and just learning by doing, I think, is what surgery is all about, really.
All trainees are allocated a clinical supervisor and an educational supervisor. The educational supervisor stays with them for the whole year and the clinical supervisor is allocated for each job they're rotated to, and we expect them to meet with their supervisor at least 3 times during their attachment, at the beginning, a midpoint review, and then a summary at the end. And it's very important that they get all their assessments done in good time and at a regular interval, rather than have a mad rush at the end.
I think there's quite a very well team working environment within the surgical department, especially in the surgical wards. We have the surgical assessment unit, which is a structured ward where you can get help from the sisters and from the nursing staff, especially for patients who come in acutely unwell, and also from the more elective or day surgery wards. You get to have quite a nice relationship with them, because you get to know them, you get to see them in the ward rounds. So as a trainee, is quite a nice environment.
Feedback's given continuously on the ward rounds, even though sometimes trainees don't realise they're getting it. And if they do want more formal feedback, then the regular meetings are times to do that. As the surgical tutor, I also run a monthly meeting for them to come and bring any worries or grievances or problems as a group, but also have one-to-one meetings which they can book individually with me.
It's really well supported here. The registrars will help you out. You've got SHOs now who help you with your day-to-day jobs, and it gives you an opportunity, especially if you're really going to be interested in surgery, to go into surgery where the consultants are more than happy to teach you and happy that you're there as well.
Yes, the surgical office is situated opposite the library on the ground floor, and all the consultants are based in there with the secretaries and are easy to find.
To book annual leave, there's a form you fill in, you've got to get it validated by your clinical supervisor, and also make sure that if it's your on-call day, you've got an adequate colleague to swap that with you, and also get it cleared by the rota managers upstairs. If they're happy that there's no staffing issues, they will be happy to sign that for you and get your annual leave sorted.
One of our service managers looks after our rota for us. He's very accessible. You can go up and see him anytime and work out swaps, or when you want to book annual leave or study leave. And all the consultants are accommodating as they can be when trying to work that all out. We also wrote our own rota when we were doing upper GI, because it was quite a large firm, in order to try and cover all the commitments. And so we do that on a sort of weekly or 2-weekly basis.
Jay for us coordinates the rota, but we're quite lucky in terms of our 0 days and things like that. We can organise it between ourselves, so long as we've always got someone on cover. That's why the consultants leave it to us, and then for our leave we can tell Jay Frost that we've organised it between us, we've got enough cover, and he'll okay it.
Yeah, so the basic ones like the BNF, and there's an app called MicroGuide, which gives you all the antibiotic guidelines to manage different inflammatory infective conditions. Also, as surgical trainees, we're expected to keep a logbook of all the procedures that we do on a daily basis. So there's an app for the e-logbook, which is quite useful.
Just enjoy being independent and having that extra responsibility. With this, the responsibility comes with support, so you're fine, and just enjoy it.
East Surrey Hospital is quite a busy hospital in terms of the on-call admissions and the on-calls being quite busy, but it's a brilliant learning opportunity. You have to learn the hard way, and I think it's a good starting point for anybody that wants to do surgery in the long term.
We welcome all the juniors to East Surrey Hospital and hope their time is fruitful and they learn a lot. We're a friendly, open department with approachable consultants, and so I hope you feel welcome when you get here.